Hi, everyone, and welcome to another great episode of NextGenMD. We're with Dr. Lily Johnston. Dr. Johnston, how many times do you have patients go down a rabbit hole when they get results? No matter what the test, they are down a rabbit hole before they even get to your consult to discuss the results.
Yep, that happens pretty often. We had a recent change in policy in the last several years that allows patients almost immediate access to both their picture tests and their lab tests. And you would not believe the number of portal messages, emails, phone calls that our office gets about these findings before we as the physician team have even had a chance to sit down and take a look at all those results. It's a big issue.
And it was a big issue for me this morning. I will share this experience because this is what drove me to say, "Hey, Dr. Johnston, I need help," because I was calling Dr. Johnston this morning on my own to say, "Help me not go down this rabbit hole with my results." So, just reversing time to a few weeks ago, I ended up with a UTI. And I went to urgent care. The doctor gave me a shot, decided to be consistent with the medication before I got the urinalysis back, of course. They have to start you on something. So started me on one medication that was consistent with the injection. And it turns out once the urinalysis came back several days later, that someone should have flagged that it wasn't the right medication, that it was proven to be ineffective. The one I was on was proven to be ineffective with this current strain of bacteria. And at that point, I'm thinking I'm going to I always tell people don't, sit there and play doctor, don't doctor Google, not going to do anything. If there's a problem, my doctors are on it. It should flag them. No one looked at my tests. So I completed the entire run of the medication. And meantime, in the last couple of days, I got worse almost to the point that I had to go to the emergency room. I could barely even walk with pain in my lower back. And I decided, you know what? I'm just going to give my primary care doctor, see if she responds quickly. She did, prescribed me a different medication and said I shouldn't have been on the other, that the urgent care doctor didn't know. So fast forward to today, I had taken another urinalysis and I was hoping everything would be much better, but everything was all whacked out. And because the last time no one had looked at it, I decided to Dr. Google. That didn't go very well because Dr. Google can't put together everything that you have, right? All of the different markers. And
Right.
I was seriously going down this rabbit hole for a couple of hours, and I was at my breaking point, which was like, Dr. Johnston, help me. But I then went to ChatGPT and I decided, okay, I'm going to put in that urinalysis, all of the different markers. I'm going to put in the blood markers, which is really what then,
Mm,
took me even further down the rabbit hole in Dr. Google. And what was interesting is that the way in which I approached ChatGPT, in terms of saying, "Hey, can you put all of this together and paint the picture for me and create a document that I could show my doctor that puts everything together with critical questions that I would ask?" And that just gave me this big moment of relief because no longer was I dying of HIV, which is what I thought. And I was thinking, I'm single. I haven't had anything going on since the last all RANA test that we all do once a year. And so I was like, I'm not sure how that would happen, but it was pretty definitive. That was the direction I was going.
I've been there, man.
But
I've been there too. I hear
oh
you.
my gosh, I mean, it's a blessing and a curse. So, what was your situation? Make me feel better.
I think it was even before I had lab work done. So it was in the days where we didn't have lab results back for a few days,
Yeah.
and I wasn't feeling very well, and I didn't understand what was going on, and my symptoms were a little atypical for just a cold. And I was in medical school at the time, so of course I had, everything. I had every major documented problem on the history of in
No.
the history of medicine. Hypochondriasis is a, you know classic thing that happens to all of us as we learn. And I'm sure I had just gone through infectious disease and probably had gotten like splashed with fluid in the operating room or maybe a needle stick injury, and was convinced that due to this needle injury, I probably got contaminated blood, even though the patient's test was negative. They were a high risk patient, and that was clearly the cause for my left pinky toe pain and my flank pain and like snot out of one nostril, right? Like those were it was just this weird constellation of things and this previous exposure. And I was convinced that I either had hepatitis or HIV and I was probably going to die, and was starting to write my eulogy. And it was very traumatic.
Wow, you get it. Yeah. Oh my goodness. So how did you resolve that issue? How did you because I think the hardest part is to take that deep breath. And I think even especially back then when you didn't have all of these resources available like Dr. Google and ChatGPT, et cetera, how did you find resolve in that moment, get your head back in order? Because certainly that's not a good headspace to be in to drive you forward. It's not very motivating.
I think it's important to remember that even those of us with advanced knowledge are still just humans. And this is always very clear to me when I am a family member accompanying mom or dad to a doctor's appointment, or dad is having surgery. In that moment, I am not a doctor. I am a daughter and a loved one, but my brain is not operating with the same level of detachment and, you know,
Yeah.
intellectual processing as it is if that's a patient. So I did what you did. I phoned a friend who had a little bit better perspective on the reality of the situation, who said, your patient's test was negative. Your test will be back tomorrow. The chances that this is a problem are a million to one. And if it is, there are treatment options. Like, this is going to be okay, whatever it is, which it's fine. But if it's not, I'm here, I have your back, we'll take care of it together, it's fine. And even over the weekend, I was on call this weekend, I had a tough case with a complication and I was spinning, was totally losing it about this patient that I thought I really hurt. And I phoned a friend and she sat me down and said, look, is there a scenario in which your patient will be okay? Will he recover? Is that
Yeah.
possible? And he said, yes, that's possible. Are you doing the things that will allow him to recover? Yes, we are doing the things that would potentially facilitate that outcome. Great, she said. That is your job. Your job is not to be perfect. It is to do everything the right step at the next step, and it will be okay. And yes, he's doing much better now. He has recovered his function.
Yay.
It's a setback, but we've dealt with it. And all that to say, phone a friend, get some perspective. If you're waiting on test results from your physician, make an appointment preemptively with your physician to go over the test results. If you have medical anxiety, or you're sure that you're going to want to go over the results, just make that appointment when you get the labs drawn, so that you'll have that opportunity and that time and space to go through it with your physician. We would much rather probably have a 5-minute phone call than go back and forth through the portal, like, or by text message or email. So if that's going to be you, plan for it. No big deal.
I love the idea of if you're in an appointment and they order lab work, or even if it's lab work ordered by email, immediately go ahead and create that follow up, immediately call and get that scheduled. So if you at least have it scheduled, then you'll know that you have something to look forward to, that there's some sort of milestone, right? You're going to be able to um, get answers at some point, within days following getting those, your results back. I know for me, once, I ended up at College U, I ended up calling my doctor's office, and I said to the person at the desk, you know what it's like to get results back. I said, it's a blessing and a curse. It's great we have them. There's so much we could do. It could provide even a big sigh of relief if it all says normal. But when it says abnormal, it's really difficult, especially when you're not feeling very good. So in knowing what it feels like, can you possibly find a way to squeeze me in? I promise I will not take more than 10 minutes of her time. And they were able to squeeze me in tomorrow, which is great. So sometimes being human and reminding people at the front desk and relating to them, I'm sure they've had the same experience. I'm sure they could figure out a way to get you in sooner rather than later with your doctor. Even if you're double booked, you may have to wait 4 or 5 hours, but you know what? At least you know that within 24 hours or 48 hours, you're going to get the answers that you need. But is there any advice that you would have based on your experience using the search engines and now specifically AI that a patient, you know, they're going to do it anyway? We always suggest number one, don't upload your full report with your name and your date of birth and all of that jazz. You just don't want that out there on cyberspace. But what other advice would you have for folks who are taking that method? I know for me, the answer really was being more proactive versus looking for a diagnosis, asking it to make sense in a way that I could have a more productive conversation with my doctor about the results and potential next steps.
Sure. And, I go through subreddits and listen to lots of stories where the large language models, ChatGPT, Claude, have been helpful for people. They have but convinced people to go in to seek treatment when they had a very serious condition. Do I think it should replace your physician? Of course not. But is it a useful tool? Yes. Are people going to use it no matter what I say? Of course they are. So I love this idea of thinking about how to use it as carefully and appropriately as possible. And I think what I want to emphasize is trying to see if you can create as much ambiguity in some ways so I don't want you to bias the search, right? I don't want you to ask, do I have HIV? What I would much rather people would say, okay, these are my results. I am a 41-year-old in otherwise good health. These are the symptoms that I have had for the last several days. I was treated with this. I'm still having symptom X, Y, and Z. These are my
Mhm.
newest results. What do you make of that? And try to be as open-ended as possible so that you're not biasing the model towards a specific answer. Because I don't know about you, Kim, but when I talk to ChatGPT, it tells me I am the best thing since sliced bread. When I ask it, what do you think about this? And so it tells me that I am brilliant and I have never made a wrong move in my life and I am so great. But what I now ask for is please provide constructive feedback because I know it's a little biased in certain ways. So if you ask a leading question, you might get a leading answer. And
I always
what would be more helpful is that broader perspective.
yes. I always say if you ask the right question, you get the right answer. So you've got to ask the right questions. And that was really what was the key. And what was also interesting is I was able to go back into my portal and I was able to find other blood work. So in we find this a lot with especially if a patient wants to go to a different doctor for a second opinion, they can't go through 1,000 pages of your records. How are they to know about every single little thing that happens
Sure.
in your past? So it's not really at your fingertips, right? In the way that people really think. So what it did for me, which I thought was really cool, is in uploading the past results with the dates, it was able to create a one sheet that actually put the comparison data right there in front of her on one page so that she could end up doing a better assessment than she probably would have been able to do if she had to comb through all the previous stuff. I mean, doctor, you guys are busy. I mean, I have one doctor that says he sees anywhere between 40 and 60 patients a day on during
Wow.
clinic days. And that's a lot of people. I don't know how, because I know even with you, you remember specific patients, like the one you were just talking about a few moments ago. Patients wonder if they stick in doctors' minds, and I'm like, yeah, no, you really, really do. But also there are 40 to 60 patients they are seeing each day, and it's not you can't remember everyone in every little detail.
Yeah, I can't see 40 patients in a day. That is next level, super level doctoring right there. But I have a patient who came to my metabolic clinic and he used ChatGPT to first of all, that's how he found me. Second of all, he used it to prepare for the visit, to have a bunch of questions laid out for us to go over together. And I think that is a super use of that tool just like you did it collated some data. I think that's really neat, right? This ability to be able to have years worth of stuff have the large language model identify probably what's the most salient or most important information, put that all on one page with dates and times and trends. That is such a great use of that tool. And it makes my job so much easier to have that one page right in front of me. And yeah, people show up with 1,000 pages of records, some of which are useful, some of which are not. It's not the
Yeah.
patient's fault. They don't know what's in there that I need or don't need, but I can't go through it in our, even if we have an hour together, it's still too much stuff to go through and address them, get their history, go through their concerns for today. So I think that's a wonderful use of that tool.
I love it. Any final pieces of advice on that when it comes to getting your results and having to wait for a doctor to go through them with you so that you don't end up spiraling out of control? I know, I'll give you another example. Just we had a patient with an ABI result, and turns out she was wearing jeans during the result, and that's not normal, right? You don't do an ABI with genes, but we had several patients actually in the past month that have, and we turned out it's not protocol, not the best way to do it. So her ABI results, despite her walking, she had upped her walking, she was feeling better, her toes were warmer, she ended up having diminished blood flow according to this ABI result. And it was devastating for her. So devastating. Her mind was going a mile a minute. She started falling into a depression again, started smoking cigarettes, wanted to eat
Oh,
whenever she wanted, and didn't want to walk anymore. She's like, why should I bother? Why should I even bother? And there was, she didn't have a doctor's appointment for another few weeks beyond this result. So a lot can happen in between having that result and seeing the doctor. So what would be your best advice in situations where you can't see a doctor right away?
two things come to mind. The first is that you can treat ChatGPT or Claude like the phone a friend if you don't actually have a friend or a physician who can talk to you right away, right? If I had been speaking to that patient after the fact, I would said, what happens if you ask ChatGPT, what's the point? What happens if you ask, what if I go back to smoking cigarettes and not walking and eating whatever I want? Is that going to make a difference? And I think what ChatGPT would have said is, that's a bad idea. The changes that you've made were hugely impactful and beneficial. And even if this is a real result, it would have been worse if you hadn't been walking and hadn't stopped smoking and hadn't been paying attention to your nutrition. It can provide at least a small measure of that broader perspective that helps us reframe when we start to spiral. And I have used it for that. The psychologists don't ever want people to use ChatGPT as a replacement for therapy. Of course, you shouldn't use it as a replacement, but can you use it to help bring you back from the spiral, help bring you back from this place where our brain lies to us and tells us unhelpful things? Yes, you absolutely can. And I have personally found it very useful for that. The second thing from a more practical perspective is, if you begin to spiral and you're thinking this is catastrophic, ask ChatGPT, what are the things that I would be looking for that would tell me I needed to go into the emergency department or that I need to see a doctor today? Like, what is truly the worst case here? What is the best case here? What are the chances that this is an erroneous or incorrect result from a test? Is that possible? Keep asking it questions. Like, you can't wear it out. So just keep asking questions. Try to stay curious rather than focusing on what you are sure is true. Keep asking questions. Just say, what are the chances that it's really this problem when I don't have these are the risk factors? What would make me need to go in and be seen today? Does this sound like an emergency? If not, what should I do between now and when I can see my doctor? What are the questions I should ask my doctor? Could I speak to a nurse instead? What other resources do I have? Keep going and getting more information and using that tool to help let you claw your way back out of the spiral.
I love it. Thank you so much, Dr. Lily Johnston, vascular surgeon in Southern California at Scripps. She also has her own metabolic practice. Make sure you do follow her, subscribe to her channel at youtube.com/. The at sign, Lily Johnston, MD. Also, like and subscribe to our channel at youtube.com/, the at sign, the way to my heart. And remember, you can always phone a friend at the Global P.A.D. Association for anything related to vascular, especially peripheral artery disease at 1-833 PAD legs.